Hello learners, welcome to the certificate course on polyendocrine metabolism, metabolic ovarian syndrome, which is PMOS, nutrition and health. So in this video we will be talking about the course overview, in which we will be seeing about the different modules and the contents that will be dealt in these modules. So module number 1, here we have 12 modules and we'll have a detailed overview of each of the modules and the contents in this particular course. Module 1 is on polyendocrine metabolic ovarian syndrome, PMOS, a new paradigm in women's health. In that we will have introduction, historical background of PCOS, scientific limitations of the term PCOS, which is misleading emphasis on ovarian cysts, misinterpretation among patients, diagnostic confusion, delayed treatment, excessive focus on fertility rather than metabolic health, underrepresentation of metabolic dysfunction, neglect of multi-system endocrine functions, and emergence of PMOS. Module 2 is about pathophysiology and clinical implications of transitioning to PMOS from PCOS. Pathophysiology basis supporting PMOS, in that we will see insulin resistance as a central mechanism, hyperandrogenism, chronic low-grade inflammation, gut microbiota dysbiosis, clinical implications of transitioning to PMOS, improved diagnostic awareness, reduction of diagnostic delays, better multidisciplinary management, and enhanced patient understanding. Next, in module 3, we will be talking about PMOS symptoms and features. In that, we will see what age does PMOS start, how common is PMOS, signs of PMOS, irregular periods, abnormal hair growth, acne, obesity, darkening of skin, cysts, skin tags, thinning hair, and infertility. Can PMOS be asymptomatic? Can PMOS cause miscarriage? Features of PMOS, reproductive, metabolic, dermatological, and psychological. Module 4 talks about PMOS diagnosis and tests, in which we will talk about physical examination. Under physical examination, why physical examination, how often, what to bring, what to expect, duration of examination and results. In pelvic examination, we will have what is pelvic examination, is it similar to pap smear, why this test, who should do this test, how often, what to bring, how to prepare, duration, results, and common concerns and FAQs. In pelvic ultrasound, we will talk about diagnostic 3D and 4D ultrasounds, how it works, what happens, are they safe, results, hormonal panel, metabolic screening, CVD panel, and other tests. Module 5 talks about the psychological, social, and therapeutic implications of PMOS, in which we will talk about psychological and social implications, therapeutic implications, under which lifestyle interventions, insulin sensitizing agents, and personalized medicine approaches will be talked about. Module 6 talks about the management and treatment of PMOS, how is it treated, hormonal birth control, insulin sensitizing medicines, medications to block androgens, lifestyle changes. For present of future pregnancies, drugs, surgery, IVF method. Does PMOS cure completely? Can PMOS exist during menopause? Is pregnancy possible with PMOS? Module 7 is about medical and lifestyle treatment options. Medical treatment options like COCP, metformin, inositol, berberine, anti-androgens, letrozole, anti-obesity and bariatric surgery, cosmetic and skin treatments. Lifestyle treatment options every day, every week, every few months, once a year. Next, module 8 is about PMOS diet. Key points to remember: PMOS and insulin resistance, best diet for PMOS, foods to avoid for PMOS, foods to include for PMOS, fat diets for PMOS, GLP-1 medications and PMOS, how effective is diet for PMOS symptoms, low GI carbs for PMOS, Mediterranean diet for PMOS, gut health and PMOS. Module 10 talks about lean PMOS and management. What is it? How to tackle lean PMOS, limiting carbohydrates, lower GI foods, vegetables, protein foods, resistance exercises, sleep cycle and stress, mental and environment support. Module 11 talks about meal ideas and quick recipes, anti-inflammatory foods, practical meal tips, meal ideas and recipes, tailoring or personalizing diet for PMOS, building a PMOS friendly lifestyle, and conclusion. Module 12 talks about challenges and future perspectives. In that, we will talk about challenges and controversies, future perspectives, comparative overview of the transition from PCOS to PMOS, scientific rationale and clinical implications. And finally, we will conclude module 12 as well as the entire certificate course on polyendocrine metabolic ovarian syndrome, which is PMOS, nutrition and health. So with this we come to the end of the course overview. I will meet you all in module 1. Thank you.